Swati Naik and welcome back on MQR AICUG TV live from Bhubaneswar. And I am privileged to have with me one of the very prestigious personality, that's Dr. Dinesh Baswal. Thank you so much sir for joining us. He is the Deputy Commissioner of Health at Government of India, precisely looking at the maternal health. Thank you so much. It's our proud moment for us to have your presence on this MQR AICUG TV.
I'm also here. I am also feeling, it's a pleasure to be here.
Sir, we will like to have your insights on the very important aspect of a public-private partnership. What do you have to say on this aspect? What all government various strategies to have a link of public and a private partnership with the doctors?
See, public-private partnership, there's a lot of promise basically, and we already have a very unique partnership, public-private partnership already existing with the Pradhan Mantri Surakshit Matritva Abhiyan, where we have developed a very good partnership, and I am happy to say that we have served around more than 1 crore of women in that, and around basically a lot of doctors have volunteered there, and they have served in high priority district, which is a very good sign, because these districts actually traditionally had been basically devoid of the obstetrician, despite government trying number of things. So public private partnership holds a lot of promise, especially we have a very unique partnership under Pradhan Mantri Surakshit Matritva Abhiyan, and government is quite open also to other partnerships. So a lot of we can have some result based financing also and all those things, and some are also being tried in number of states. So government is quite open on that.
Fantastic. Sir, how FOXI is associated for this public-private partnership? What is the FOXI and Government of India collaborating on this aspect?
FOXI has been a very good partner with us, and we actually have been having a partnership right from one partnership which is already existing was through training the MBBS doctors in for an 18 weeks course, where they were being basically skilled for doing cesarean section, and that partnership is going on from very long time. And after that partnership, we have also entered this Pradhan Mantri Surakshit Matritva Abhiyan is the second partnership, and we look forward to all more partnerships so that we can develop this and serve this society.
Absolutely. Very happy to know about it, sir. Would you like to throw some light on the aims of Government of India for the maternal health in India?
See, what basically the aim of the government is that by 2020, we need to reduce the maternal mortality by below 100. We already have a target of maternal mortality reducing below 70 by 2030. But the government has announced in last year's budget that we have to reduce the maternal mortality by below 100. And a lot of strategies are being in place, and we are latest being Lakshya program, where we are focusing on basically care at birth, because that is the time when we lose a lot of mothers. So we are actually focusing on this, and government is actually working on basically we are already working, and we are actually seeing that how it can be scaled up, and we will be starting with this time alone. First time we are also taking medical colleges, because earlier medical colleges were excluded. It's the first time that we are also including medical colleges.
Fantastic. Very nice to know about it, sir. Sir, how do you feel that or what has been your observation on anemia being contributing to a maternal health?
See, anemia is a big problem with us, let me tell you. And we have been, the latest figures also with the pregnant women with 15 to 45, 49 years of age. We already have, the reduction. In some of the states, there is a marked reduction. But otherwise, at least, a lot of women, especially having severe anemia and moderate anemia, they still die with the, PPH. And one of the contributory factors for maternal mortality has been anemia, and the hemorrhage being one of the principal causes. And the data which was available, which is an old data, of course, in 2001-3, where RGI showed that the major cause of hemorrhage has been 38%. So it's still a very major cause of deaths which is happening. So anemia has been, and we have to see that, and government actually is working on we have developed guidelines, but latest the government is trying to develop a guideline for anemia free.
Absolutely. Fantastic, sir. I think the year is not far away that we would like to have a lesser and lesser maternal mortality, and anemia not to be the contributing factor for that maternal mortality, with the availability of so many preparations for iron, that is whether it is a oral iron salts or the parenteral iron preparations.
Absolutely.
We at MQR also do a lot of scientific activities, patient-centric activities, HB detection camps. Last year we did a Limca Book of Record activity where we tried to tap the spontaneous screening of anemia, and we did a prick of near about 16,470 pricks at 35 centers, and the figures are still bothersome. That is near about 67% of anemia that is coming up in the general population. And in that context, maternal anemia becomes a very significant entity. And I think we also at MQR would like to join hands to the Government of India initiatives in eradication of this very treatable disease. Sir, would you like to give one key message, a one-liner message to the fellow obstetrician and gynecologist who have come here all the way to Bhubaneswar, and they would like to take that message on behalf of Government of India?
I think one of the things which I will request the fellow colleagues to actually volunteer in large numbers, because the program is already running, and it's already 1 year now, the program Pradhan Mantri Suraksha Matradar Abhiyan. They should come in large numbers, they should serve the society, and together we can achieve this.
Absolutely. Thank you so much, sir, for joining us on MQR ASUG TV. Thank you so much.